morning, everybody, and thank you for attending our stakeholder briefing for the California Initiative to Advance Precision Medicine 2021 Annual Report. My name is Shannon Muir, and I am one of the co-directors for the California Initiative to Advance Precision Medicine, or CIAPM, which is based in the Governor's Office of Planning and Research, or OPR. I am joined today by my co-director, Dr. Julianne McCall, Communications Specialist and Administrator Megan Varvey, Science and Technology Policy Fellow, Dr. Alex Colon Rodriguez, Doctors Clara LaJean-Cher and Keith Yamamoto, Chair and Vice Chair of the California Precision Medicine Advisory Council, and Dr. Ken Kim, who's Chair of our Equitable Consent Working Group. Today we'll provide an overview of CIAPM's annual report that was released this morning and is downloadable from our website. This briefing is being recorded and will be posted on our website next week. At any point during today's briefing, attendees are welcome to submit questions using the Q&A option at the bottom center of their screens. And if there's time at the end, we'll open the floor for live Q&A. We'll start first with remarks from California Precision Medicine Advisory Council Chair, Dr. Clara LaJean-Cher, and Vice Chair, Dr. Keith Yamamoto, and then have remarks by our Council Working Group Chair, Dr. Kenneth Kim, and then move on to highlights from the annual report. So Dr. Clara LaJean-Cher is the Deputy Director for the Institute of Precision Health at the David Geffen School of Medicine at UCLA. Prior to UCLA, Dr. LaJean-Cher held faculty appointments at USC Keck School of Medicine, where she served as the director of the NIH Center for Genomic and Phenomic Studies in Autism, with focus on underserved populations. She also served as VP of Clinical Programs for Autism Speaks for over a decade and currently consults for several tech startups in the autism space, focused on AI, robotics, and targeted therapeutics. Clara.
Thank you so much, Shannon. And thank you all for joining us for this overview of CIAPM's 2021 annual report. In 2021, despite the challenges of COVID, the CIAPM staff continued their work to help ensure that advances in precision medicine absolutely benefit all Californians, not just the 1%, including those impacted by systemic and institutional racism. As you'll see in the following briefing, CIAPM has demonstrated its continued dedication to identifying and tackling some of the root causes of racial inequity through the work of the Equitable Consent Working Group, the research projects addressing cancer disparities and adverse childhood experiences, and the participation of CIAPM staff in the Capital Collaborative on Race and Equity. You'll also have the pleasure to hear about CIAPM's work to enhance their support of the larger California precision medicine community by revamping the precision medicine asset inventory, which will improve the user interface, or rather has improved the user interface, and also by providing on their website precision medicine educational resources that are appropriate for a wide variety of stakeholder groups. I'm incredibly proud of the progress that CIAPM has made in 2021 under the leadership of Dr. Shannon Muir and Julianne McCall, and look forward to seeing the initiative further advance California's health equity goals. Back to you, Shannon.
Thank you so much, Dr. LaJean-Cher. And now for our Vice Chair. As UCSF's first Vice Chancellor for Science, Policy, and Strategy, Dr. Keith Yamamoto leads efforts to anticipate the needs of an increasingly dynamic biomedical research endeavor. As chair of the National Academy's Board of Life Sciences, he created the study committee that produced Toward Precision Medicine, Building a Knowledge Network for Biomedical Research and a New Taxonomy of Disease, which was the report that really enunciated the precision medicine concept. And he also has helped lead the efforts to implement it at the state, federal, and school efforts at UCSF. We would also like to take a moment to congratulate Dr. Yamamoto for his recent election to lead the American Association for the Advancement of Science as its incoming president-elect. Keith.
Thank you, Shannon. In 2021, the Newsom administration and the state legislature once again demonstrated their commitment to advancing precision medicine by allocating an additional $12.4 million for a total of about $20 million to address adverse childhood experiences and toxic stress in some of California's most underserved communities. the state government recognizes that California's world-class research institutions can push the boundaries of knowledge while also narrowing equity gaps in healthcare practice, access, and affordability. The work of the Data Integration Working Group will help to ensure that we maximize the utility of our public investment in precision medicine research. Even as other states impose new healthcare restrictions that will disproportionately affect those with fewer resources, including people of color, California continues to invest in the promise of precision medicine so that everyone, regardless of their demographic classification, can receive care that is appropriate and beneficial. We seek in this briefing to convey the amazing advances that can be made when academia, communities, the private sector, and government work together. I am absolutely inspired by the research that is underway and planned, and I'm confident that you will be as well. Shannon, back to you.
Thank you so much, Keith. Ken hasn't been able to join, and so we are going to jump right into our presentation. So before we start off with all the work that we're doing, we quickly wanted to cover, what is it? What is precision medicine? What is the definition that we use? And it's really the right treatment at the right time to the right person. Precision medicine is also sometimes referred to as personalized medicine, and it places humans at the center of healthcare. And it integrates all the information about a person to create a better picture of their health. And that's information about, family health history, genetics, social determinants of health, behavioral factors, anything that can affect the risk of developing physical and mental health conditions. So now we'll talk specifically about the California Initiative to Advance Precision Medicine, or CIAPM. The initiative was created by the legislature at the behest of Governor Jerry Brown, who learned about precision medicine through his own battle with prostate cancer. And the idea was that California is such a leader in science, medicine, technology, and it's really positioned to advance the field of precision medicine. It was established to help coordinate public, private, and nonprofit partners to advance the important intersection between science, research, and medicine, and to foster the creation of new technologies and therapies that can improve the health of Californians. Since 2014, the legislature has appropriated $65.4 million to CIAPM, and as of 2021, we've funded 18 precision medicine demonstration projects based on their potential to provide benefits in the short term to patients within 5 years, improve clinical outcomes, achieve commercial success, and reduce health disparities. We'll now give an overview of our California Precision Medicine Advisory Council. In 2019, the Newsom administration created the California Precision Medicine Advisory Council with members selected both by the governor and the legislature. Council members are recognized experts in the area of precision medicine, data science, pharmacology, community engagement, medical devices, and public health. We have 11 council members, including 2 ex officio members, the Acting Surgeon General of California and the Deputy Secretary for Policy and Strategy at the California Health and Human Services Agency. And we also have 2 members who were selected by the legislature, Dr. Fatima Munoz by the Senate and Dr. Ken Kim by the Assembly. As you can see, the council members represent academia, industry, venture capital, community organizations, and community health clinics. The council currently has 2 working groups. The first is data integration, and they're working on facilitating the integration of social determinants of health data into health records in a way that optimizes their clinical utility and leads to better outcomes. The second is the equitable consent working group, which is curating guidelines and tools for biomedical research stakeholders to increase diversity, equity, and inclusion in biomedical research participation. So now we'll jump into talking about our demonstration projects, which are really the core of CIAPM's work, and we'll briefly touch on the completed and ongoing CIAPM funded projects. CIAPM funded its first 2 demonstration projects in the fall of 2015, and then 6 more in the winter of 2017. These 8 projects, which focused on pediatric cancer, infectious disease, mobile technology, genetic sequencing, and a lot of other topics, have now all concluded. In 2019, 3 research teams began projects aimed at addressing cancer disparities within Latinx populations. Remarkably, these projects have earned over $20 million worth of follow-on funding, which really further expands the impact of California's investment. In 2021, 7 additional research teams launched projects to address adverse childhood experiences and toxic stress. We'll now dive into very quick status reports about the current cancer disparities projects. The first is called Reducing Cancer Disparities through Innovative Community Academic Partnership to Advance Access and Delivery of Precision Medicine in Monterey County, and is led by Dr. Manali Patel out of Stanford in collaboration with several partners. The project aims to partner with communities to create effective interventions by developing, implementing, and then evaluating a community health worker approach that increases access to precision medicine at every stage of cancer care, including prevention, treatment, diagnosis, and then end-of-life care as well. The study's also already screened over 400 participants and enrolled 50, and they're mostly from low-income households who identify as Latinx, are Spanish-speaking only, and have less than a high school degree. The second cancer project is developing an integrated machine learning platform to inform precision therapy in underrepresented triple-negative breast cancer patients, and it's led by Drs. Pablo Tamayo and William Kim from the Moores Cancer Center at UC San Diego. They're collaborating with a number of other universities and organizations, as you can see. This project focuses on triple-negative breast cancer, which leads to higher mortality rates and is also really prevalent within Hispanic women. And the project leaders brought together researchers, clinicians, just stakeholders really across the board to help find new treatments and create a better system to match triple-negative breast cancers to existing therapies. They've also done some outreach with stakeholders and found that many patients didn't know or understand what kind of breast cancer they had or the treatments that they received. Latina women are less likely to participate in clinical trials for a number of reasons, including geographic and financial barriers, not being offered the opportunity, fears about experimentation, and fears about immigration status. Providers often felt helpless to address these social determinants of health. They know that they impact patient outcomes, but they don't have the time or resources to address them. The third project is called Addressing Disparities in Breast Cancer in Latinas, a multi-tiered approach, and is led by Dr. Elad Ziv at UCSF in collaboration with City of Hope and other partners. Understanding hereditary cancer risk can improve outcomes by identifying women who should start screening at an earlier age, more frequently, and with more accurate methods. The research team has trained 24 promotoras, or community health workers, who held educational sessions about hereditary genetics, risk, and genetic testing with over 800 Latina women. Dr. Ziv and his team have also sequenced the DNA of breast cancer patients and controls and found that certain genetic variations are associated with an increased risk of breast cancer in Latinas. And I'll now turn it over to our Science and Technology Policy Fellow, Dr. Alex Colon Rodriguez, who will discuss the demonstration projects focused on adverse childhood experiences, or ACEs.
Hello, everyone. In 2021, we concluded a competitive 16-month request for proposals process that was significantly impacted by COVID and launched 7 new projects that are working to address ACEs and toxic stress. Out of the original pool of 39 applications from 14 research institutions, our out-of-state expert selection committee recommended 7 for funding. We do not have time to go into detail, but we nonetheless wanted to briefly exhibit how phenomenal our expert selection committee was. Take, for example, the chair of the committee, Dr. Melissa T. Merrick, who worked at the CDC as the agency's science lead of ACEs. She is now CEO and president of Prevent Child Abuse America, a leading nonprofit. I also want to say that one of our selection committee members, Dr. Kenneth Ramos, is one of our attendees today, and we would like to thank you personally for your commitment and service. The first ACEs project we would like to showcase is helping understand which children are most vulnerable to the effect of ACEs. This project is called the Collaborative Approach to Examining Adversity and Building Resilience, in short, CARE. This project is led by Dr. Nidha Thakur at UC San Francisco. It aims to identify what family and community level factors provide the most buffering protection, which interventions most improve child and family outcomes, and to personalize interventions to fit individual physiology and environmental circumstances. The second project is led by Dr. Ariane Marie Mitchell at Loma Linda University, and it is called a multi-component intervention to strengthen families and build youth resilience. This project aims to mobilize pediatricians, community health workers, and parenting educators to improve the delivery of information and resources to a diverse population of families with ACEs across the Inland Empire region. In addition, it will train service providers to use an evidence-based method intended to strengthen families and build youth resilience. Our third project is called Systems-Based Multidisciplinary Assessment of Adversity and Toxic Stress for Individualized Care. And it is led by Dr. Tina Sinth at Stanford University. Their team is using machine learning and artificial intelligence to create the first clinical diagnostic tool for toxic stress by integrating multiple disciplines and taking a systems-based approach rather than just symptoms-based. The results of this study will lead to earlier detection and more targeted clinical recommendations to address the root causes of toxic stress. Our next project is led by Dr. Pat Levitt at Children's Hospital, Los Angeles, and it is called Scalable Measurement and Clinical Deployment of Mitochondrial Biomarkers of Toxic Stress. This project aims to improve early screening by combining a questionnaire with innovative laboratory tests that detect disruptions in metabolic health, a key indicator of toxic stress. This project will bring a greater understanding of infant caregiver well-being and through screening, close the equity gap in access to quality behavioral health programs. Next, we have the project at UCLA. This one is led by Dr. George Slavic. This project is titled Identifying Social, Molecular, and Immunological Processes for Mitigating Toxic Stress and Enhancing Personalized Resilience. This community-driven team will develop a statewide network of scientists and clinicians who focus on stress and conduct research to uncover how stress impacts the body and what we can do to increase people's resilience. They will develop the first ever statewide stress surveillance system, which will help governance and public health officials respond quicker to help promote individual and collective resilience. Our sixth project is led by Dr. Tali C. Baram at UC Irvine. The title of this project is Using Precision Medicine to Tackle Impacts of Adverse and Unpredictable Experiences on Children's Neurodevelopment. The goal of this project is to identify the degree that ACEs influence children's neurodevelopment and discover for each child a marker that can predict their level of resilience so that targeted interventions can be delivered to children who need it the most. This team aims to screen 100,000 children across Orange County and apply interdisciplinary expertise in brain development, emotional health, health disparities, community engagement, epigenetics, big data, database design, and sharing. Our final project is titled Advancing a Precision Population Health Approach to ACEs to Reduce Health Disparities. This project is led by Dr. Gary Feinstein at UC San Diego. This project aims to solidify a network of system of improvement among Latinx communities, community health workers, community clinics, and UCSD to strengthen communications, needs assessment, and research community relationships to better design and deliver the right treatment services at the right time. They have created a family-based approach to improve individual and community-wide resiliency to address health impacts of stress and obesity. I'll now turn it over to Megan Barvez, who led the CIAPM's participation in the Capital Collaborative on Race and Equity.
OPR was part of the 2020 through 2021 cohort of the Capital Collaborative on Race and Equity, or CORE, which is a racial equity capacity building program for state government employees. CIAPM staff attended monthly trainings to learn how to embed racial equity practices into every aspect of their work. Trainings included a history of race in America, how to reframe the language and messaging that we use around race and privilege, and root cause analyses of racism and inequity within our program's purview. CIAPM has incorporated the principles of CORE into its program administration.
Thanks, Megan. I'll now turn it over to Dr. Julianne McCall to cover CIAPM's other activities.
Thank you so much, Alex. Health policy, as you all know, is such a vast field that progress requires partnerships and cooperation across specialties, expertise, and agencies. CIAPM staff participate in several interagency efforts with the goal of reducing health disparities and addressing other top priorities of the Newsom administration. These efforts include membership on the governor's COVID-19 testing task force, the Surgeon General's senior leadership team, and trauma-informed primary care advisory committee, the California Essentials for Childhood Initiative, and the 23-agency Health and All Policies Task Force, coordinated by the Office of Health Equity at the Department of Public Health. Now, to better facilitate cross-sector collaboration, CIAPM hosts an online interactive mapping tool with a searchable inventory of precision medicine assets throughout California. Assets include published data sets, researchers, academic and commercial laboratories, and community and patient organizations, among others. Public users can click on entries for more detailed information on any of almost 500 assets that can be filtered by organization type, activity, and health topic. In 2021, we completely revamped the asset inventory to improve user experience and better meet our goals of raising awareness of precision medicine assets in California. Team members also created a tutorial YouTube video to introduce new users to the inventory search, filter, and editing features. In 2021, CIAPM also continued regular communications with its network through its newsletter and social media. In July, the newsletter was redesigned to look and feel more contemporary, and CIAPM used reader feedback to help align newsletter topics and features with readers' priorities. We also work closely with OPR's communications team to post social media content that keeps our network informed of important announcements, upcoming meetings, and general precision medicine news and research updates. Also in 2021, we used our new website to launch a public-facing precision medicine primer that introduces new audiences to precision medicine, answering questions like, what is precision medicine? How will data change healthcare? And who is protecting health data? The primer also addresses important concepts like whole person care and patient-centered research. We also developed an accompanying resource library with different levels for the public and professionals that provides additional precision medicine information from reliable, curated sources. CIAPM accomplished much in 2021, and 2022 is somehow shaping up to be an even busier year. Our goals for 2022 are to support ongoing demonstration projects for ACEs and cancer disparities, to advance the California Precision Medicine Advisory Council Working Group projects, specifically in equitable consent frameworks and data integration of the social determinants of health, to expand outreach to legislative representatives and interagency partners about work in their districts and in their particular stakeholder groups, to act as a hub for new ideas and collaborations among precision medicine stakeholders, to refine communications and public engagement, to leverage the expertise to serve California's needs, and to infuse racial equity in every aspect of our programmatic approach. We have so many people and partners to thank. Shannon, if you don't mind, thank you. To thank both past and present for making our work possible. But no one deserves more credit than our dedicated and talented CIAPM team, as you'll see on your screen right now. Now, this concludes the overview of our 2021 report. We have a few minutes remaining to open the floor now for taking your questions. You can either type your question via the Q&A option at the bottom center of your screen. If you would instead like to speak, please use the raise hand feature on Zoom. If you are calling in on a phone, you can raise your hand by dialing *9. We will call on you and unmute your microphone in turn. I will now pause for just an awkward enough silence to inspire any questions. To anticipate any questions, this recording, as Shannon mentioned at the top of our webinar today, will be not only recorded and posted on our website, but also be for anyone to watch on demand. So feel free to check in on our website, and we will also be announcing the publication of the link on our newsletter. So stay tuned there. I would just briefly, since I don't see any questions, I would briefly like to acknowledge a few of our very special partners, and that includes one of our advisors, Dr. Fatima Munoz, Dr. Ken Kim, who I see has now just joined us, Dr. Ben Rubin, Associate Director of Precision Medicine at UC San Francisco, former science officer of CIAPM, our phenomenal policy fellow, Hannah Chu, as well as our former research PI, Ms. Isabel Bjork at University of California, Santa Cruz. Dr. Kim, welcome to the webinar. Thank you so much for joining. We know that you have an extremely busy schedule. We are wrapping up. If you would like to provide some concluding remarks on the 2021 year at CIAPM, I would love to hand you the microphone for a brief minute.
Are you handing me the microphone? Yeah, okay.
Yes, thank you.
Well, I think it's going to be an exciting year. I think there's been a lot of progress with the 2 working groups. I think that the committee that on equitable consent, we're engaging community stakeholders, and we like to create a really excellent web resource in that arena. And so we're very excited about the progress that's being made.
Thank you so much for your leadership with the working group on equitable consent frameworks. We're absolutely delighted to stay in touch with our stakeholders through our newsletter, through social media, and we always are happy to receive your emails at ciapm@opr.ca.gov. So with that, we'll really conclude our presentation today. Thank you all so much for your attendance, for your interest. We hope you'll stay in touch and enjoy the rest of your day. Thank you again to all the panelists. Take care, everyone. Bye-bye.
Thank you.
Thank you.